Okay. Um, Hello and welcome to all of you on behalf of Dermaqual Paris. I am Dr. Sam Zeeshan, a dermatologist based in the UAE, and I will be going through a masterclass regarding skin treatments, which will help benefit our patients more. So all of our activity that we're doing right now, it boils down to one simple word, that's beauty. And the phenomena of beauty has been studied extensively by social scientists, and it has been found by research. In fact, a research was conducted by the Business Insider magazine, and it has been evaluated that beautiful people are actually considered more smart, more intelligent, more likely to be successful in romantic and business endeavors. And as we all know, that skin health is the foundation on which the whole principle of beauty lies. So skin health not only indicates beauty, but also shows your own overall wellness and health. And issues with skin health can lead to number of struggles with mental health, self-esteem, depression, as well as suicide ideation. It is no wonder today that skincare is a multi-billion-dollar industry, and we need to have working solutions which leave our consumers more and more satisfied. So keeping that in mind, we have designed this masterclass where we will combine a few treatments together to produce solutions. And those few treatments can be PRP with mesotherapy combination, 24 points injection technique, which is injection technique using non-cross-linked hyaluronic acid, radio frequency microneedling using a Suprema device, and use of mono screw threads for skin rejuvenation. I will be going through 3 different conditions one by one, and I will be showing how to manage these conditions to achieve best possible outcome. The first thing that I'm going to talk about are acne scars. All of us know by now that acne scars are some of the most stubborn, most annoying, and causing a number of self-esteem issues for our patients. So treating acne scars remains a big challenge for the dermatologist as well as for the patient. Based on what we feel patients are going through, we have designed stages of treatment which help to produce better outcome. We cannot, with simple treatments like these, we cannot really go on to achieve 100% perfection in scarring. But combination of these treatments can result in satisfactory results for many of patients. So depending upon the grade of your acne scars, you can start with subcision, but do keep in mind that not all acne scars will need subcision. And combine this subcision with PRP and our EGF cocktail, which is our growth factor cocktail for mesotherapy. This can be followed by radiofrequency microneedling, again in combination with the growth factors. Then you may go on to add non-cross-linked hyaluronic acid injection as well as poly-L lactic acid threads. All of this for skin rejuvenation. So let's look at each of these treatments one by one and try to find out how and why they work. So there have been multiple studies for subcision and PRP on their own, but a combination of the two can be done together as well at the same time. And in a multi-center study, PRP appears to add to the improvement of grade 4 scarring when combined with subcision. So subcision alone is effective, but adding PRP to it makes the treatment much more effective, as can be seen by this study. You wouldn't want to do subcision in ice pick scars, for example. So subcision is optional, but PRP is what we would say that would help in all kinds of scarring. Box scar and box scarring is the most, the kind of scars which will respond to subcision, but not ice pick scars. Okay. And in another study on PRP alone, about 30 participants, which is about 33% of those taking part in the study, They showed improvement from grade 3 to grade 2 using PRP on its own, without microneedling, without any other intervention. So the idea behind including data from published researches is to add more credibility to the treatment protocol that we are offering. So PRP on its own can work, combination of PRP with subcision can work. Let's see what else can help in this situation, and that is the addition of growth factor cocktail, EGF. EGF, or the growth factor cocktail by Dermaqual, that contains important ingredient. Along with the growth factors, it contains sodium DNA. And sodium DNA has been studied for quite some time. It helps in improving skin nourishment, and it just generally overall speeds up the cellular turnover process and helps in rejuvenation much faster. Now, this entire protocol can then be shifted to radiofrequency microneedling. Basically, radiofrequency is non-ionizing radiation, and the device that we have, which is Suprema, it is a non-insulated device. So because the needles are going deeper in the dermis, they're not entering into the epidermis at all, like they're not damaging the epidermis at all. The heat is spreading evenly within the deeper dermis, and that goes on to produce collagen remodeling. A study was conducted in France, and about 60% patients reported improvement of over 60% with the use of this device alone. And as with all microneedling, there is a formation of microchannels. So microchannels will ensure better drug delivery within the dermis, and pairing this device with EGF cocktail again can give you much more results. This is the study which was done, which says the non-insulated fractional microneedling device does give significant improvement in acne scarring, pore size, as well as skin texture. This is a video demonstration of the device Suprema. You can adjust various parameters. Apply the cocktail prior to the treatment. Now let's look into the role of non-cross-linked hyaluronic acid, which is getting a lot of popularity currently because of its role in skin rejuvenation. So there have been studies done. Generally, when we talk about fillers for acne scarring, we talk about cross-linked fillers. However, there is published data which shows that non-cross-linked hyaluronic acid does contribute significantly in improving acne scarring in patients. And this effect gets more multiplied when you combine it with PLLA threads, as we'll see in the next few slides. So according to a published study, the patient satisfaction rose from 60 to 90% when combinedly treated with hyaluronic acid injections as well as PLLA threads. Now, there is something interesting I would like to add here, that when it comes to threads for regeneration, monoscrew threads, in a case like, the choice basically depends on the doctor. But in a case like acne scarring, where we are dealing with atrophy in the skin, PLLA threads would be somewhat preferred to PDO threads because of better volumizing effects, although both can be used. I would like to share the results of a patient treated with this protocol. He presented with severe atrophic scarring of more than grade 4 intensity, I would just call it. It's very intense. Maybe the pictures don't do justice to the scarring. And we didn't get enough time to monitor him over 3 and 6 month period. So this result is only after 2 weeks to 3 weeks of final thread insertion. And you can appreciate that a lot of scarring has improved, and he has shifted from grade 4 to at least grade 2 scarring now, within 2 weeks of thread insertion. So we are expecting much more improvement as time goes by. And this is another picture of the other side of the cheek, where now only redness and pigmentation mostly remains, and much of the atrophic scarring is improved. So that was all about the acne scarring protocol. If we talk about next very common concern in dermatology, and that is anti-aging. So let's have a look at extensive anti-aging treatment protocol and what actually is included in that. It's true that all of us are subjected to forces of nature, and we will age quite significantly depending upon our lifestyles. So commencing treatments early on does help in preventing extensive aging. This anti-aging protocol starts with PRP with Mesoglow. The cocktail that we are suggesting to use for anti-aging is the reverse aging cocktail, which is Mesoglow. This can be combined with 24 points injection technique, which is an injection technique with non-cross-linked hyaluronic acid, followed by radiofrequency microneedling and insertion of either PDO or PLLA threads, depending upon the doctor's comfort. So let's begin with the first step, PRP with Mesoglow. PRP has been shown to improve the outcomes for aging in a number of assessments, both by patient as well as observer assessments. So PRP helps to improve your pore size, improves the wrinkles, as well as improves the skin elasticity. Addition of Mesoglow. Mesoglow, the cocktail Mesoglow is the reverse aging cocktail which contains sodium DNA. Now, research of sodium DNA, the breakthrough was achieved in 1986 when the Chernobyl disaster took place, and interest in nuclear studies generally grew a lot. It has been seen that the injected DNA molecule, the sodium DNA molecule, it enters the cell by endocytosis. Cells then acquire the injected plasmids, and then cell goes on to make its own cofactors and regenerate new epithelial tissues. Because of this, the result you will get is a better appearance of facial wrinkles and better hydration. So to incorporate the sodium DNA much better in the dermis, we have designed a 24-point injection technique. Basically, the non-cross-linked hyaluronic acid gets the advantage that because of lack of cross-linking, the hyaluronic acid can flow freely across the dermis, and this results in better skin hydration. Most research use for this product happens to be around the periorbital and perioral wrinkles as well as necklines. And this technique, which has been designed by Dermaqual, it is designed to introduce the hyaluronic acid very evenly across the face and neck. This is the distribution that we have suggested along the zygoma, along the jawline, as well as along the nasolabial folds, and linear spread across the neck. All right. So this injection of non-cross-linked hyaluronic acid can be followed by later on with radiofrequency microneedling. Radiofrequency microneedling is basically the device that we are using uses non-insulated needles, and they help to safely deliver the radiofrequency energy within the dermis while preserving the epidermis. This process itself induces controlled wounding. Skin response is stimulated, leading to growth of new collagen and new elastin because of the proliferation of fibroblasts. This eventually also results in the thickening of epidermis. As we have been following all the treatments with published data, so a multi-center study published showed that about 65% patients reported significant improvement in mid and lower face sagging. So radiofrequency microneedling, we can conclude that it is an effective treatment for sagging as well as anti-aging purposes. This is the study which shows that non-insulated microneedling RF treatment does help with wrinkle reduction and lifting of the lower face. And finally, once we are done with these treatments, we can insert monothreads for the patients, and this will also result in collagen generation. So a study which was conducted in South Korea, it showed about 50% of patients expressing satisfactory level of excellent following PDO threads for skin rejuvenation. What actually happens in thread insertion is that fibrosis takes place along the placement of threads. This process itself recruits basically neutrophils and fibroblasts on site. And these cells now, they are near the thread site and they are activated to form granulation tissue and in turn lead to collagen production. This presence of fibroblasts is the main mechanism which ensures new collagenesis, and this is the thing which generates skin elasticity. Now, question arises that which thread to use, either PDO or PLLA. Basically, this choice depends a lot upon the comfort and experience of the service provider. When we talk about PDO threads, they do have a shorter degradation time, but the inflammatory response is also mild, as well as volumizing effects are milder compared to PLLA. PLLA threads last much longer, about 14 to 18 months, but they also produce significant inflammation, and they can cause volumizing, which may not be needed in all cases. Another interesting thing to note down is that using non-cross-linked hyaluronic acid, it can shorten the longevity of PDO threads in place of PLLA. So it's advised that do not use the non-cross-linked hyaluronic acid along with the PDO in the same session and give a gap of about 7 to 10 days when using a non-cross-linked hyaluronic product. For PLLA, there is no such restriction. PLLA and non-cross-linked hyaluronic can be used within the same session. And this has been studied in a research conducted in South Korea, where they checked the hydrolysis of PDO threads following the insertion of hyaluronic acid. So the hydrolysis of PDO really speeds up when hyaluronic acid has been injected. This is one patient, result in her face following Suprema and the entire anti-aging protocol. You can appreciate the lower face laxity is lesser, as well as nasolabial folds look more lifted. We can now move on towards the last part of our talk today, which is the flawless complexion methodology. It is true that the best foundation you can wear is your glowing, healthy skin. Every makeup artist would attest to that. Every other person would attest to that. Skin clarity is considered one of the most widely respected aspects of a beautiful face. So it's important to work towards maintaining a healthy complexion. Flawless complexion, again, relies on similar treatments, but with small differences. So we can start the treatment by doing something which we at Dermaqual call glow shot, PRP, combined with glutathione and vitamin C. This can be followed by radiofrequency microneedling with Suprema device. And in the end, we can perform 24 points injection technique, which is the similar technique of introducing non-cross-linked hyaluronic acid. So PRP is not a new technology. It has been well researched. And a split phase study, which checked the Massey scores, Melasma Area Severity Index, it was evaluated using saline versus PRP. And the group containing, which was offered saline, showed in about 24.3% participants showed an improvement, whereas the side which was treated with PRP, 75.7% patients showed an improvement, which is a massive difference. So what makes PRP effective for melasma? PRP contains a number of growth factors, up to 30 growth factors identified, and maybe even more than that. And most significant of these when it comes to melasma is transforming growth factor beta, which is a tyrosinase inhibitor. And this data is based on a pilot study conducted on 10 participants in Thailand. Now, we are proposing addition of glutathione within the PRP to bring about improvement in the melasma. So I did have a search in the literature, but I couldn't find any data combining PRP with glutathione in the same session, in the same setting. But I did find that glutathione does compare significantly to vitamin C and tranexamic acid. Glutathione acts as a antioxidant and scavenges free radicals. So, as can be seen from the chart given, the group percentage of patients treated with vitamin C and tranexamic showed an improvement in only 30% cases, whereas the same combination with addition of glutathione, the percentage of satisfaction for patients rose up to 70. So, a significant difference with the addition of glutathione itself. This is the process of PRP preparation. (3,500 RPM for 10 minutes). Now you can add the mesotherapy within the PRP tube to ensure better mixing of the two. This is the PRP kit by Dermaqual, Biogenics kit. It comes with a number of accessories. Okay. The next treatment for pigmentation is Suprema radiofrequency microneedling. As discussed earlier, radiofrequency microneedling has multiple uses. So when it comes to pigmentation and melasma, the role happens to be improved transcutaneous elimination of melanin. Thanks to the treatment being a non-insulated device, we have a lower complication rate with lower downtimes, and most importantly, it is safe on darker skin types, which happen to suffer with more severity of melasma. Because of the action of microneedling, microchannels are created, which can be used for drug delivery. So the same glutathione cocktail can be topically used after Suprema treatment or during the treatment itself to ensure that dermal absorption of glutathione is widely improved. Then, as a next part of improvement in pigmentation, we can combine mesotherapy of hyaluronic acid non-cross-linked HA35, the cocktail HA35, with the cocktail Nefertiti Lift. So what exactly is Nefertiti Lift cocktail? This cocktail combines two active ingredients, DMAE and silanteriol. Both of these provide powerful anti-aging, anti-wrinkling, better skin elasticity, and better skin rejuvenation. Whereas non-cross-linked hyaluronic acid helps a lot in dermal plumping and improving skin elasticity and firmness. This is a study which was conducted, published in Journal of Cosmetic Dermatology. And mesotherapy with hyaluronic acid-based fillers is a favorable method for restoring youthful appearance, rejuvenation, and revitalization. You have to ensure for any hyaluronic acid mesotherapy that you must reach within the dermis, as too superficial an injection will lead to Tyndall effect. Addition of Nefertiti Lift helps with better hydration. Basically, DMAE and silanterol both act as synthetic silicones, which do help with better firming of the skin. So not only do they provide better dermal hydration, but also promote better cross-linking between collagen and elastin fibers, resulting in better skin firming. These are the results on patients. You can see that pigmentation is still there, but the intensity has lightened up, and overall complexion has also brightened up significantly. As well as here, where a patient had post-inflammatory hyperpigmentation following a chemical peel, and that has improved significantly using this protocol. So in the end, the take-home message is that be kind, look after your skin, because you'll be using your skin will represent you for every day for the rest of your life. For more information, please log on to Dermaqual website, and I am available for any questions if you have any, and that's the end of the program. Also, all of you will get some certificates. So if you can come to our booth on level 1 and give your names, so you'll be issued certificates for this attending this session. Thank you, everyone, for taking out time and coming here and listening to the presentation. Thank you very much.